Yeah, hi students. I'm Dr. Badrinath, and we are looking the topic of serotonin 5-HT antagonists. This is my second video in the serotonin antagonists. First video I have already completed. Serotonin, what is the introduction, what is the chemicals, happy chemicals, all etc. I have already discussed it in the first video. You first see that video and later we will come to this. Okay, later you listen. Now in this video we will see the antagonists. We will come to the mechanism of action and antagonists. That part we will see, right? And here in this slide, here you can see this is a fungus. Natural ergot alkaloids. Natural ergot alkaloids. Very powerful serotonin antagonists. Okay. It is obtained from the nature, obtained from the fungus, which is obtained from the plant source. Okay. Right. The fungus which is grown on the plant source. Keep in your mind. The fungus grown on the plant source. From that we will obtain the ergotamine alkaloid. It is a antagonist of serotonin. And why we have to go for serotonin antagonists? That was the biggest question mark. I already told that serotonin is a happy hormone. Serotonin receptors are also there, indicated by the HT. Total, there was a 4 families are there, 7 receptors are there, HT, and subclasses also there. Okay, why we have to go for this serotonin antagonists? See here, I will give you the picture, clear picture. All this is the story about the serotonin. Serotonin, first it is a synthesis here and storage. Serotonin synthesis is produced in the directly in the neuron. See here, this is a presynaptic neuron, postsynaptic neuron. Pre means prepaid, post means postpaid. Prepaid, postpaid. In between that, in between, you have a synaptic cleft, the gap. Okay, gap. See here, here you can see synaptic cleft. Synaptic cleft, what it is? It is a gap between the presynaptic neuron, postsynaptic neuron. Presynaptic neuron synthesizes the serotonin hormone. Here you can see in this cell. And it is storage in the vesicles. That is also very important point in the exam they will ask. Okay, vesicles or storage is the storage for the serotonin. And third one, release. See here, vesicles will take up here, synthesize, and it starts dumping here in the synaptic cleft area. Serotonin is released. Now the serotonin will go and attach. All these are the 5-HT serotonin receptors. Receptors. So all the receptors will be get activated by the serotonin. Once serotonin receptors get activated by the serotonin, there is a depression. Keep in your mind. There is anxiety. Depression, anxiety. We don't want that depression. We don't want that anxiety. Keep in your mind. That's why serotonin, happy hormone, it is always happy to be maintained in the synaptic left. Okay, synaptic left. Don't, it should not go to the postsynaptic neuron. That is the main objective here. If it goes to the postsynaptic neuron, there will be anxiety, there will be depression. That's why we are using a serotonin antagonists. Our serotonin antagonists, how it acts means, it go and blocks the serotonin receptors. All these receptors will be completely blocked by the, so there is no place for the serotonin. Serotonin is always in the synaptic cleft. So no anxiety, no depression, Be happy. That is the main secret here. Number one mechanism. Blockage of the serotonin 5-HT receptors. Number one. Number two, you come here. So as usual, these receptors, when here it is releases, there is a chance of reuptake. Presynaptic cleft or presynaptic neuron will take up the again the serotonin. See here, how many ways are there? 5A, it reuptake, 5B, SERT, 5C, reuptake. See how these five, all these steps are reuptake. After reuptake, it break down by the catalyzers. MAO, mono amino oxidase. It catalyzes the serotonin. It breakdowns. Now we are giving a check, one check here. I have already kept one check. Our antagonist drugs kept one check by blocking the serotonin receptors. Number two, reuptake will be inhibited by our antagonists. Reuptake of the serotonin. The 2 points you have to keep in your mind. Okay, that is the main mechanism of the today's video is blockage of serotonin receptors. Number one. Number two is inhibition of reuptake of the serotonin. Always you have to maintain the serotonin in the synaptic cleft. It should not go into the postsynaptic cleft. Mechanism of action. Now you can read. These serotonin antagonists are also called as a SARI. SARI, not SAREE. That is saris, what you will wear. Sari. Okay? Not sari. It is a sari. SARI, not SORRY. Serotonin antagonists. SARI means, see here, SARI, serotonin antagonist and reuptake inhibitors. Serotonin antagonists, that is blockage of the receptor. Reuptake inhibitors called as a serotonin antagonists are a class of drugs used mainly as antidepressants. Whenever you feel depression, you will go into the depression by reading or by processing some other things or go to the anxiety. You have to take a 5-HT antagonist. You have to take SARI, SARI. Okay, then your anxiety will be breakdown and also your depression mood will be suppressed so that you will feel very happy. They act by antagonizing, see here, antagonizing the serotonin receptors such as a 5-HT2A and inhibiting the reuptake of serotonin, norepinephrine and dopamine. Yeah. Now we will see what are the various class of the. These are the, as per your Tripathi book, K.D. Tripathi, Essentials of Medical Pharmacology book. The same book, what I am showing here, these, yeah, here you can see the book. This book I am following, okay. As per this, there is a some antagonist, 5-HT antagonist, cyproheptadine. The same points you can find here. Cyproheptadine, number one, methylsergide, ketaserine, clozapine, and risperidone, not reserpine. Reserpine is a Rauwolfia serpentina, antihypertensive drug. It comes in the pharmacology, not here. It is very different. Risperidone, keep in your mind. And ondansetron, very popular drug, last one, ondansetron. Apart from that, ergot alkaloids. See how many is there? 1, 2, 3, 4, 5, 6, 7. Total 7 are there. Keep in your mind, right? And clozapine and risperidone shows almost similar. That's why I have put in only one line. Keep in your mind. Both are different only. It is not a synonym. It is not a synonym. Both are different. I gave all the colors in a different color. The same colors what I used here, I used in the uh, slides. That we will see now one by one. For your easy identification, for easy clarification, easy remembrance, I made different colors. Cyproheptadine. See here, cyproheptadine. Syrup is available. Tablet is also available. Dose is 4 mg. You have to write in the exam. 4 mg. It is available in the salt form. That is hydrochloride salt. Okay. Cyproheptadine as a serotonin antagonist, 5-HT antagonist, it blocks the 5-HT2A. It is very, very important. In the examination, they will give you the drug name and receptors numbers. And also they will ask either it is a selectively blocked, non-selectively blocked, either it is a potent, non-potent, like that they will ask in the competitive examination. That you have to keep in your mind. Blocks the 5-HT2A receptors, controls the intestinal manifestations of carcinoid. Very important point. It is a specialty for this drug only. Carcinoid, it avoids the intestinal carcin, means tumors. You know very well. See here, tumors are there. 1, 2, 3, 4, 5. All these parts causes a tumors in the intestine part. That part who can be avoided. If is there anything, the tumors can be avoided by using the cyproheptadine. It can be cured to a little bit. And next one, apart from this, the same slide, post gastrectomy dumping syndrome. That is also, first you have to know post gastrectomy. It is a surgery of your stomach. Surgery. See here how the surgery is made. Gastrectomy. Whenever the people are very fat, they will undergo for bariatric surgery. This is bariatric surgery only. Stomach will be cut down. See the passage from the, this is normal passage, normal one. This is the surgical one. This entire part is bypass. See here, direct bypass is there to the intestine. Food from the esophagus enter into the stomach, only a small part of the stomach, and immediately it goes, it emptying into the intestine. That's why intestine feel burden, because stomach is not there. Intestine feels the burden. And also see here one more type of bariatric surgery. See, stomach is, they will cut like this, and here you can find both sphincters is there. Upper sphincter and lower sphincter are there. It is connected. Only it is divided by two. Divided by into two parts they have. Okay. So after this surgery, what happened? There is one syndrome will be developed. That syndrome is called post gastrectomy dumping syndrome. This is especially, you can see here, dumping syndrome. He will feel that there was a dumping in the intestine. All the food he is taking, a plenty of food, and it is all dumped here in the intestine. That's why to avoid that type of a syndrome, this is very important in competitive examination. Post gastrectomy dumping syndrome, which drug is suggested? Next, antagonize the priapism. It is a long time erection of the penis. Priapism. Next, this drug also shows, other than the serotonin antagonists that we are seeing, actions other than the serotonin antagonists. H1, antihistaminic, anti-allergic. See, this is the histamine. I made already video. Antihistaminic also I made video. This drug specially you are using for the both antihistaminic, anti-serotonin, cyproheptadine. Keep in your mind, that is very, very important. In the exam, they will ask you which drug is used as a both antihistaminic, anti-5-HT, that is anti-serotonin like that. So you have to choose the correct option, cyproheptadine. H1 antihistaminic allergy, and also it is also antihistamine. Histamine causes the allergy, I have already told in the video. Anti-allergic, this is using. Anti-pruritic, here you can see anti-pruritic, you will feel the itching, allergy will be there. Apart from that, when you feel the scratch, when you feel to scratch your skin or your allergy, then you can say it is a pruritic. And increased appetite, weight gain, very important for those who are all very thin. It is, this drug is very important, it increases the appetite, so you will get a weight. If you want to gain the weight, if you want to build your body, then you can take this drug. Recommended in the children and poor eaters, though taking very poorly, they are taking that. In that, for such, for them you can. Anticholinergic action, it blocks the acetylcholine. Anticholinergic, against the acetylcholine. Sedative, see how this fellow is doing that. Sleepy feeling, sedation will be there, no activeness. And cyproheptadine side effects also important for competitive exams and regular exams. Number one, drowsiness. See here, drowsiness, dry mouth. You can feel very dry. If you are taking the drug regularly, you can feel these. These are the side effects. Definitely, the side effects will come whenever you are taking a medicine. Confusion. See here, confusion. Ataxia. It is also appeared in the old question paper. Ataxia is a side effect of cyproheptadines. Ataxia means a cross walking. All are you are walking like this. These ataxia people, they walk like this. Cross. They will come and clash you. Okay. See here how these persons are suffering with ataxia. Cross walking. Weight gain, you can see the weight gain symbol here, you will get weight, that is a side effect also. If for fat persons, for lean persons it is a positive only. Yeah, this is methylsergide, is a specialist in the migraine headache. You can see here migraine headache, it is also called one side headache. One side, partial, one side divided by, your head is divided into two. One side you will get a pain, that is called a vasectomy. In such a case, because higher amount of serotonin leads to this, that's why you have to go for blockage of the serotonin. Potent 5-HT2A 2C, very potent antagonists. Non-selective, blocks the 5-HT1 also. Chemically related to ergot alkaloids. This is also appeared in the question paper. Which of the following drug is chemically, structurally related to the alkaloids? Methylsergide. Mainly used to avoid the migraine. Once suppose say you got a migraine today, you took a tablet and your migraine has gone. And after 4 days or 1 month or 2 months, you have a fear that you maybe get a migraine. In order to avoid, prophylaxis means avoid. To avoid that, migraine prophylaxis. Prophylaxis means avoidance. To avoid the migraine, this drug is given, methylsergide. Cluster headaches also, very cluster, you cannot define the headaches. In such a cases, it is an expert, methylsergide. Red color I gave here. Previously I gave orange color. Next, blue color. Ketaserine. This is a selective 5-HT receptor blocker, especially very strongly blocks the 5-HT2A subclass than the 2C. 5-HT2 having a subclass A, B, C, D and all. This blocks the 5-HT2A strongly. It is a vasodilator, dilates the blood vessel. That's why BP will be reduced. That's why we are using as an antihypertensive. Blood vessels dilator. I already told serotonin is a vasoconstrictor. Are you remember that? Now antagonist, this dilates the okay blood vessels, and this drug is expert in Raynaud's disease. Raynaud's, you know Raynaud's pen, Raynaud's, not Reynald pen. Reynald pen you keep in your mind. Raynaud's, peripheral blood vessels overacting to the cold. See, this is the peripheral, almost at the end. Peripheral means side, toes, fingers. This is called as a peripheral. Whenever there was a cold environment, especially in the old age, these fingers acts overaction. They do overaction, and it looks like this, almost a very freezing condition. In such a cases, this drug is expert. This disease name is important for competitive exams. Next, clozapine. Number of times it was appeared. Clozapine. Okay, Anand color. I used Anand. It blacks the 5-HT2A 2C, 2A 2C. Dopaminergic also. This is very very important. Clozapine blocks the both 5-HT2A, dopamine receptors also. Dopamine, I already told, it is also one of the happy hormone. It is a pleasure hormone. Anti-psychotic drug, widely prescribed in the Ergot mental hospital. This drug was widely described. You come to the Hyderabad, you go to Ergot mental hospital. It is a famous, okay, for psychics. All the psychic patients are there. The doctors are prescribing like anything, clozapine, clozapine. Each and every prescription almost consists of clozapine. Okay, because it is a mental psychosis and also schizophrenia. This is also one of the mental disorders, schizophrenia, in which the people interpret reality abnormally. You are taking the reality as a abnormally. If you have disease, you check it. You check your mental condition. Okay, don't take anything abnormally. You take as it is. Otherwise, you are suffering with a schizophrenia and mental disorders. Psychosis will come. That's why, right? Ondansetron, very popular drug, even for small childs to big age people also using this. Doctors are prescribing like anything, especially those who will feel nausea, vomiting. Nausea means, feeling of vomiting, not the vomiting. Feeling of getting the vomit is called as a nausea. Nausea as well as the vomiting, it will be avoided by the ondansetron tablets. Go and ask in medical shop. Whenever you feel nausea, you can go and ask. You can be take directly, no problem at all. The medical shop pharmacists, they are giving directly. Whenever you will ask the sir vomiting me, they are giving ondansetron. Okay, very popular drug. Specialist in the nausea and vomiting. Excellent results you will get. Ergot alkaloids, that is the final one, which obtained naturally. See, this is black colors are the fungus. From this fungus only this. So here you can see ergot alkaloids are the more potent alpha blockers present in the blood vessels. Alpha blockers, alpha receptors are that causes a direct smooth muscle contraction. They are the products of fungus. Claviceps purpurea. Name is very important. Claviceps purpurea. Now you go to the classification: natural, semi-synthetic, synthetic. Natural means from the nature. Semi-synthetic means you modified something. Naturally obtained that you are taking and you are modifying something is a semi-synthetic. Synthetics means completely prepared in your lab only. That is called a synthetic. So natural derivatives of tetracyclic compounds, lysergic acid, number of times it was appeared. Amine alkaloids, this is also Amino acid alkaloids. This is ergometrin. Ergometrin belongs to amino alkaloids. Ergotamine belongs to amino acid alkaloids. Both are natural only. Ergotoxin and semi-synthetic bromocryptin. Number of times appeared. Methylsergide. See, this methylsergide is obtained from the nature and you modified something. It is a specialist in the migraine. DHE, dihydroergotamine. Synthetic, finally synthetic, non-lysergic acid derivative. This opposite to that of this one. Okay, metergotin. And this is about the ergotamine, very powerful ergotamine in the CTZ, chemoreceptor trigger zone. It is very powerful for the nausea, vomiting. Ergot, ergot, ergot. You can see here, no vomiting. Moderately potent. Again, antagonist of the 5-HT2 in the intestine. Now, ergotamine. This is a structure, but generally not required. It is also CTZ, chemo receptor trigger zone, potent emetic via and oxytocin. Okay, right. Yeah, I will end my session here. In my channel playlists, you click on the playlists. There I kept arranged all my videos in the subject wise. Okay, that you go and see that.